Rumenotomy in cattle. So the indications are ruminal reticular disease such as ruminitis, foreign body such as traumatic reticulitis or reticuloperitonitis, and ruminal content removal such as impaction, toxic ingestion, or before pericardectomy. For the procedure, it's done when the animal's standing. You sedate with xylazine and you can give ketamine or butorphanol, which is intramuscularly. You do it standing because there's less assistance needed and there's minimal tension on the suture, and the udder is also protected. And physical strength is also needed, and there's more risk of recumbency in a heifer. If a cow is recumbent, either dorsal or laterally, it needs to be restrained. So standing decreases the risk of peritoneum contamination, and you don't need as much assistance, and there's less post-operation complications. The area to prepare is from rib 12 to the tubercocci, as seen here, and you clip, scrub, and use alcohol. The best approach is the left paralumbar fossa, and you need to do a proximal lumbar paravertebral nerve block, or a local block. And then you need to do an oblique incision, going laterally. You go through the skin, the subcutis, the external oblique, and then the internal oblique, then the transverse, and then the peritoneum, and then you're into the abdominal cavity. For the Goitz method, you need to isolate the caudo-dorsal blind sac, and then you suture the rumen to the skin. This is to avoid contamination, and you use monofilament horizontal mattress suturing. For the Weingartz method, you need to isolate the caudo-dorsal blind sac and you stabilize the rumen with hooks to a metal ring. Then you can check and remove ruminal content and remove the foreign body. When it comes to foreign body penetration prognosis, if it's ventral, it's good, if it's craniomedial, it's medium, and if it's deep cranial, it's bad. The intraruminal drugs are magnesium oxide, rough hay, water, and mineral oil. Mineral oil helps in the case of omasum impaction. Then flush the area and then suture the rumen using 2 to 3 absorbable seromuscular inverting cushions or Lombard suturing. Then you suture the abdominal wall. First the peritoneum, the internal oblique, and the transverse oblique, using 2 to 3 absorbable monofilament sutures with simple continuous suturing style. And then you do the external oblique and the subcutaneous with 2 to 3 monofilament simple continuous. And then you suture the skin with 3 synthetic non-absorbable interlocking sutures. And after the operation, you give antibiotics, fluids, and NSAIDs, and then you remove the suture material after 10 to 14 days.